I'm a little late to the Reddit game, but we just created a subreddit, Dr. Mike, spelled out, please. Someone instantly shared with me in a private message that there is a thread with the question posed to the doctors of Reddit, what is something that you wish everyone knew about their body? It has 16,000 responses. I'm about to weigh in on this, react to what people are saying. Are you ready? I'm ready. Bear, are you ready? Be-woo! What do I want people to know about their body? You need 7 to 9 hours of sleep as an adult. I don't want to hear people say that they think they function better on 5 hours because it's just not statistically or scientifically true. Superman, Wonder Woman, you still need 7 to 9 hours as an adult to be healthy. On average. Antibiotics only work against bacteria. They're not some kind of wonder potion that cures anything. They shouldn't always be given. I'm sick right now. I know that statistically 90%, 80% of the time this is viral. The fact that I'm getting better slowly, my fever's going away, it's not bacterial. If all of a sudden my fever spikes, then I'm gonna go and get some antibiotics because I know I'm getting a bacterial superinfection. Most of these are viruses. And if your doctor gives you a once over, does a proper history and physical and tells you you don't need antibiotics, don't force their hand. You're only doing a disservice to yourself. Tell us what drugs and alcohol you're on. We aren't gonna tell the cops, we aren't gonna lecture you, but it might change the anesthesia I give you. Some stuff I give you might kill you. If you drink a 30 pack a day, tell me. Okay, this goes into the whole idea of patient confidentiality. So first of all, if you tell your doctor something, no one else in the world is gonna know about it unless you give us the rights to share that with that person. There is a lot of drug-drug interactions that we wanna avoid. Very commonly, at least in my line of work, what's happened is a patient, I can sense, or I know they have a history of cocaine use. And if you give a medication as a beta blocker, which you give to slow the rhythm of the heart, improve circulation to the heart after a heart attack, you don't want to give these two medications together. So when patients come in, I ask them, tell me what drugs you've taken, tell me what you've been taking most recently. They get all nervous thinking I'm gonna call the police. That's not what we're asking for. We're asking for to make sure to give you the best possible care. When we ask you your last drink of alcohol, it's that so we can avoid a condition known as delirium tremors. It's a very dangerous condition that can lead to seizures and even death. Trust us, we're looking after your health, nothing else. There's a wide range of normal. Don't be embarrassed by your body. Having said that, if you're concerned about anything, ask your doctor. We generally have heard it all before, and trust me, we have nearly always seen it all. Maybe you have something that has been bothering you for ages, but you were too scared or embarrassed to ask about it, so just ask. It might be nothing and you have been stressing about it for no reason, and if not, then you're at least one step closer to getting it fixed. No one can help if they don't know. There are no stupid questions, so ask away. I think this is a really good point. When patients ask me the very simple question of, when should I go see my doctor? The answer is, if something is bothering you, or if it's giving you anxiety. The longer you wait, two things happen. You build up more anxiety about the issue, or two, you can actually make the condition become worse, and progress to the point where treatment may not work as effectively. Some people seem to think that if you act healthy for a bit, it'll make up for being a wreck. There's a lot wrong with this. One example, antioxidants are like gas for your car. You can store up a certain amount of vitamins, but your tank can only hold so much. If you binge and overfill your tank, it doesn't do anything except excrete it as waste, and you can't expect to go the next several months without gas. Just because you're bringing in extra materials that we know you need to maintain a healthy liver, bones, brain function, whatever it is, it doesn't mean that you're actually gonna get better bones if you have more materials. The same way that if you're building a building and all of a sudden I say, well, you know what, instead of giving you the materials you need for this month, I'm just gonna dump all the materials you need for the next year. And now, does the building get built faster? It doesn't. It would help if more patients knew their family history. Prevention is becoming more and more important in medicine, and treating a disease in its early stages is a lot better than catching it late. That's very true. I think that in general, we as a society are not very good at keeping track of our medical history. Many of my patients come in and can be taking 10 medications, not know what they are outside of the color, size, and shape of the pill. They don't know what medical diagnosis they have, which ones have resolved, and they don't no longer suffer with that illness. And then the family history is obviously in addition to that. The more we can stay on top of that and be leaders for our own health, the better outcomes we're gonna have. I beat my meats. Okay, not the greatest name. Don't do DIY surgery or hold off on reporting things that are obvious warning signs. Don't be the guy who tried to remove his skin cancer with a knife. Duh? Yeah, please don't do your own surgery. I have seen some videos online of people like popping their cysts. Stop that. Stop that. Just because you watch some pimple popping videos on YouTube doesn't mean that you're qualified to do that. It looks simple, but there's a lot of things that can go wrong. There could be a blood vessel there that you pop and now all of a sudden you can't control the bleeding. What are you gonna do then? What happens is whatever cyst you took out actually turned out to be cancerous. Now you'll never know because you didn't send it to pathology. Good point, Pete My Meat. You need some kind of exercise. Doesn't matter how you feel right now. Sitting for 12 to 16 hours a day will have negative consequences. 100% true. In fact, before doing this video, I contemplated doing a video on the dangers of sitting. That may sound funny, but it's so true. Sitting is like the new smoking, is a slogan that's been used by media companies, and some people saying, oh, it's overblown, it's overblown. The amount of risk is overblown, but the fact that sitting for too long affects your mental health, your physical health, your cancer risk, muscle aches and pains. Stop sitting for 14 hours at a time, playing video games, Netflix, YouTube, all this stuff. Take a break, stand up, go for a walk, get a puppy, go on a date, get some water, go pee. Whatever your excuse is, walk around and be happy and healthy. Your kidneys and liver cheerfully do all the toxin elimination you'll ever need. I love that term, cheerfully. Cleanses and other detoxifying products are BS, woo, and a waste of money. The people who sell them are predators who only care about your money becoming theirs. That's 100% true. As I said in my TED Talk, IKA experts are interested in one thing and one thing only, and it's not slimming your waistline, it's slimming your wallet. That administering CPR compressions as soon as possible is one of the greatest indicators of successful outcomes. You are right, and that's why we say chest compressions, chest compressions, chest compressions. Instead of saying hands-only CPR, I like saying chest compressions, chest compressions, chest compressions, because that's the first thing you should do if you feel no pulse and someone's non-responsive. You'll not only save a life, but you'll be proud that you too have some medical knowledge, can improve this world. Some things just don't belong in your rectum. I would go ahead and say most things don't belong in your rectum. I think some is an understatement there. You often will feel normal even with high blood pressure. It's found incidentally, so don't wait until it gives you symptoms you don't want to go through. Very good point here. Too many of my patients think that because they feel fine, that there's nothing wrong with their blood pressure. It's not something you feel. It's something intrinsically happening that your heart has to battle against. Therefore, you increase your possibility of developing heart disease. And as we know, that's not good. And also strokes. Even worse. Not only should you be listening to your doctor and taking the medications or treatment that the doctor prescribed to you, you should be taking it regularly and consistently. I'm a vet, but I'm sure doctors will have come across this too. Amputated limbs do not grow back. I've had too many people asking me how long it will take for their pet's amputated limb to grow back. So I'm assuming a few doctors out there will have patients asking the same of their own missing limbs. Yeah, limbs don't grow back. If you reattach them the right way, they can heal, but they don't regrow. Ooh, Kofico, your mental health is just as important as your physical health. How did I not give that one to you guys in the beginning? I'm so passionate about that. If you are not healthy mentally, it will reflect in your physical health. Give you a simple example. If you're very stressed or depressed, that can affect your blood pressure. When your blood pressure is high, it causes increased rates of heart disease and stroke. If you're depressed and your cortisol levels are high, which are your stress hormones, it constantly keeps your body in a high sympathetic state, basically a fight or flight state. It doesn't heal well, it doesn't digest well, you don't get nutrients from food very well. You could see how a worse mental state will give you a worse physical state outcome. Believe it. This isn't woo-woo. Just because a part of your body hurts does not mean that part of your body is damaged or out of alignment or needs to be repaired. You can have tissue damage without pain, or you can have no tissue damage with a lot of pain. Absolutely correct, absolutely agree. And the reason why I actually discourage my patients from rushing to get MRIs, here's what happens. If you take 100 people who have no back pain, you scan their backs, meaning their spines with an MRI, you'll find that 70 to 80% of them will have some sort of finding on that MRI. What that finding means is pretty much nothing, because clinically they're pain-free, they can function well. Now, if you take someone who has back pain and then you find one of those findings, then you might be able to say, well, they have this herniated disc, they have back pain, it's probably because of that. 90% of sports injuries, like back pain, do resolve with conservative treatment like physical therapy. So one of my first and foremost treatments that I give to my patients outside of like the home exercise program, osteopathic manipulation that I do, is physical therapy. Do not rush for unnecessary surgery, or even worse, unproven treatments, which there are a ton of. Please, if you want some more videos with me and the bear pup to see how he's doing, like maybe a day in the life bear video, definitely drop it down below in the comments and check out this video of actually 7 reasons of why maybe you shouldn't be getting a dog, even though I love bear. As always, stay happy and healthy.